Here in Australia, your health, your well-being, and even how long you get to live can come down to one simple thing, your postcode. Today, we're diving into Australia's health divide. It's really a tale of two very different experiences, showing just how much your address can shape your destiny. It's all built around this idea called the postcode gap. And the concept is, well, it's as simple as it is shocking. Where you live can actually predict your health better than your own genes or lifestyle choices. This idea is really the foundation for everything we're about to unpack. So, what does this gap actually look like on the ground for real people? We're going to break it down by looking at two communities that are facing their own unique and sometimes overlapping health challenges. All right, so let's start with our first story. This one takes a close look at the huge health challenges that Aboriginal and Torres Strait Islander peoples are up against, a story of really deep-seated disparities that are still very present today. And it really starts with the most basic measure of health we have, life expectancy. For First Nations peoples, you're looking at 71.9 years for men and 75.6 for women. Now, compared to non-Indigenous Australians, that's a gap of 8.8 and 7.8 years. That's not just a statistic. That's nearly a decade of life. And this divide isn't just physical. Look at this number, 2.4 times. That's the rate of psychological distress. We're talking anxiety, depression, high levels of stress, and it's almost 2.5 times higher for First Nations peoples. It's just a crystal clear sign of a massive mental health burden. When you dig into the leading causes of death, this chart tells a powerful story. You got chronic conditions like heart disease and diabetes right at the top, which isn't a huge surprise. But look at that third slice, suicide. It makes up over 5% of all deaths, and it's a heartbreaking direct link back to that psychological distress we just talked about. Now, these things don't just happen in a vacuum, right? They're driven by what's going on in the environment. There's something called distance decay. It's this idea that the further you live from a service, the less likely you are to use it. That really hits hard with access to doctors. Then you add in overcrowded housing and the fact that healthy food can cost up to 50% more, you can see how this cycle of poor health just keeps going. But here's the thing, that is absolutely not the whole story. It's also a story of incredible progress, of resilience, and of solutions that are driven by the community itself. And these strategies are making a real, measurable difference. Just take smoking rates. In a little over a decade, the daily smoking rate among First Nations peoples has absolutely plummeted, from 35% down to 20%. That is a massive public health success, and it's proof that when you have targeted, community-led campaigns, they really work. And here's a perfect example of how it works. You have culturally safe programs like Headspace's Yarn Safe campaign that are designed by and for the community. They're built on a foundation of trust. And the results, they speak for themselves. Over 11,000 young people have reached out for help. It just proves that when you have the right approach, people will engage. Progress also comes from knocking down those bigger systemic barriers. And education, well, that's a huge factor in a person's long-term health. Thanks to things like scholarships and special entry programs, university enrollment has jumped by nearly 10 percentage points in just 2 decades. That's opening doors to better jobs, more economic stability, and ultimately, better health. Okay, let's switch gears and turn to our second story. This one is about the 7 million Australians who live outside of our major cities. For them, their health is being shaped not just by who they are, but by the incredible vastness of this continent. And that postcode gap we talked about, well, it's staring us right in the face here. For those 7 million Aussies living in rural and remote areas, their life expectancy is, on average, 1 to 2 years shorter. It's a direct, measurable impact of geography. So what's driving this gap? Well, it's a mix of things that all pile on top of each other. You see higher rates of smoking and risky drinking, but the one that just stops you in your tracks is that in very remote areas, people are 24 times more likely to be hospitalized for domestic violence. And underneath it all is the tyranny of distance. 18,000 people live more than an hour away from even basic medical care. So what's being done about it? Well, one approach is to tackle economic opportunity, because that's a huge driver of health. The Remote Jobs Program is a massive investment, nearly $300 million, with a goal of creating 6,000 jobs by 2030. It's a direct shot at closing that economic gap that so often leads to poor health. And it's not just about jobs, it's also about connection. Technology is starting to bridge those huge distances. These 56 regional study hubs and 52 remote Wi-Fi hubs, they're so much more than just internet hotspots. They're lifelines. They connect people to telehealth appointments, to online classes, to services that were basically impossible to access before. Okay, so for our final section, let's bring these two stories together. Because even though they're distinct, you start to see this common ground of shared challenges. And understanding that overlap is really what points us toward a better path forward. And when you lay it all out like this, you really see that common ground, don't you? Doesn't matter if we're talking about First Nations communities or the wider rural and remote population, the big hurdles are the same. Access to healthcare is a battle against distance. The cost of living is a huge problem, especially for fresh, healthy food. And that economic gap, it just creates a cycle of disadvantage that's incredibly hard to break. And that brings us to the most important insight of all. In both of these stories, the things that work best, whether it's Yarn Safe or a local digital hub, are the solutions driven by the communities themselves. So the question really isn't if we can close these postcode gaps. The real question is, how do we empower every single community to lead its own way forward?